May is Mental Health Awareness Month, and this is a time to promote mental health and its impact on our overall health and well-being. Now, during this period, you are likely to see more blog posts about mental health, more television segments, more videos, even posts on social media. But if you're living with a mental health condition, this issue is front and center every single day. In the United States, 1 in 4 adults have a reported mental illness, and nearly 20% of adolescents aged 12 to 17 had a major depressive episode. There is also one death by suicide every 11 days. And if there's one death by suicide every 11 days, there are countless other people who are attempting to die by suicide. Now, this isn't always dinner conversation. In fact, it's more difficult for some people to discuss these kinds of issues at all, depending on your cultural background or stigma around mental health. While May is set aside to talk about mental health awareness, all year long, our nation should be focused on what it means to support collective mental health and well-being, understanding that good mental health care is an individual as well as a collective responsibility. There are some issues and some needs that if they're not met, it is impossible to have positive or strong mental health care. And right now, I'm thinking about the need for housing, the need to earn enough to take care of your family, the need for quality childcare, the need for adequate education, the need to be able to go to school and not be criminalized in the process, or to walk through the community and not be criminalized based on the color of your skin. And so there's so many other factors that impact a person's mental health beyond just what that individual is doing. I think all year long, policymakers should be working to establish more services and resources for people in our society. Now, as I think about mental health, I'm really interested in the convergence between mental health and race. And we hear about families whose children struggle at schools to receive what they need. And a lot of times, if you consider the school to prison pipeline, the young people who are most vulnerable are young people of color. And so that's Black youth, Latino youth, Indigenous youth, but also young people with a mental illness or a disability. And we know that with mental illness and disability, not all are discernible to the eye. So this is an issue that I'm deeply concerned about based on my own experience, based on watching other people navigate their own mental health issues, and based on what we know about schools and young people of color. We've also heard far too many stories and been made aware of far too many instances when a family has called the police seeking help for a loved one who's having a mental health episode, and that person ends up being killed. Like, that should not happen in a civilized society. Now, I host a podcast called Faith Talks, and it's a production of United Women in Faith. And today, May 16, I'm doing a conversation on the convergence of mental health and race and how it shows up in schools and how young people of color are treated. I'm going to speak with Professor Kristin Henning, and she's the author of the book Rage of Innocence: How America Criminalizes Black Kids. I was going to speak with Cheryl Poe, but she had a last-minute situation, and I'll need to talk to her another time. But I'm also going to interview Dara Baldwin, and Dara is the Director of National Policy for the Center for Disability Rights. You can listen in on that conversation. The link is in my bio. You can also go to United Women in Faith and click on podcast and pull up the Faith Talks podcast, and you'll be able to register. My intention in having this conversation, even in making this video, is to share hope, but also concrete tips to help you care for yourself and the people in your life. Again, if you want more information, you can visit United Women in Faith for more details. Thanks so much for listening. And by the way, if you haven't already subscribed, please be sure to do so.